Hey, good evening, everyone. Welcome to the third quarterly meeting of the District 5 community meeting. And I'm Counselor Cynthia Borrego. I am your counselor for this district. I am really honored tonight to have a distinguished group of individuals that have joined us. And I'm just going to say right up front, we are having some issues with our Zoom connection. So it may be that this meeting is recorded and then it will be placed on YouTube after the fact. We did have an opportunity for our constituents to write in with their questions, and we only received one question, which I will address at the end of the meeting. I also have a distinguished group of individuals that are on the agenda tonight, including Commander Arturo Sanchez, our crime prevention specialist, Pete Galibert, and I'm going to have to change the agenda a little bit. I know we had environmental health listed first, but Commander Sanchez has indicated to me that he's going to have to jump off a little bit sooner. So I'm going to allow him to go first, and also Pete. And then we will go to environmental health. We also have, with environmental health, we have Dr. Mark Demena, and with Albuquerque Fire and Rescue, we have our battalion chief, Pasquale Galucci. I think I said that right. And then we are going to be moving on to an issue that concerns all of us. It's the Cibola Loop development, and we're going to be starting that off with our affordable housing update with Rick Hidon, a community services specialist from Family and Community Services. Our Cibola Loop Multi-Gen Center regarding the update of where that is. And I also thought I saw Lisa Hubal, who's one of the deputy director at Family and Community Services. So that's the order of the agenda that we are going to proceed with tonight. I'm sorry I had to change that around a little bit, but it's important that we have an update from Northwest Area Command and our Commander Sanchez. So with that, I'm going to give Commander Sanchez an opportunity. I had an introduction, but I'm going to save that till the end, because I think it's important that we have him speak. Commander Sanchez, were you able to jump on?
Yes, ma'am. Can you hear me?
We can hear you, but we can't see you. And I know we were having some issues with that. So would you like to go ahead with your presentation?
Yes, absolutely. Again, I want to thank everybody for having us here. Counselor, like always, we appreciate your support. I think I may be getting the video, but there it went. But nonetheless, I do appreciate, again, the support that you provided us. There's not a whole lot going on in the Northwest Area Command, which is sometimes good. There are a few things that we have been working on. And I'm glad that I know that environmental health is on here, and I do apologize in advance that I won't be able to stay for the whole meeting. But I know there has been, well, let me go into the crime stats just a little bit. Peter will get into it a lot more, but we're still doing pretty good on our property crimes. We're still seeing reductions on property crimes. Our auto thefts are starting up again a little bit. Violent crimes, we're still in the, unfortunately, in the positives. However, the positives are not as high as they were about a month and a half ago. So that's always good. We did, in Counselor, you were actually there. We did have our one of our business coalition meetings in August with Cottonwood, and we're going to continue those. I think it was really positive. We're hoping that we're going to have more, more the business owners attending. The other thing is that we are working, and I know there's been a lot of issues and a lot of concerns regarding one of our local businesses at Cottonwood, which is the salt yard. I did meet with the general manager there, and we did discuss the noise complaints that have been going on. We are scheduled to sit down and meet not only with him, but with the owner to try to come up with a resolution. However, I did indicate to them that we were going to be doing our own monitoring with reading reading the decibels and and to see if it is going to be legitimate complaints, or if it's just the perception again, and that's going to be important. But we are working with them. I told them that that we are not. Their concern was that they're worried that we may, we're looking to shut him down, and I expressed that it was not our intent. It was not my intent, the department's intent, and even Councilor Borrego's intent. It was to make sure that they continued with their business. However, that it was important that they followed the rules and the ordinances to ensure that we didn't affect the quality of life of the surrounding neighborhoods. So we are working on that. But other than that, everything, I really do think we're moving in a positive direction in the Northwest Area Command.
Thank you, Commander. And the business you're referring to is a bar at Cottonwood, a bar restaurant that we've gotten complaints from a number of residents that mostly live in Corrales. There's a couple that live in Albuquerque, but the majority of them have come from Corrales residents. And that is what the commander is referring to because of these outdoor concerts that they're having. And I know that you're working with environmental health and also our code enforcement folks. And our intent is not to shut down the business. It is to provide an environment that's conducive for everyone to enjoy. So I just want to echo that. And thank you, Commander, I know that's been a delicate situation. And, we do want to let our businesses know that we do want them to stay in business and continue. So thank you for working on that. And I know that you also attend the community policing councils. Would you like to just mention that a little bit?
No, absolutely. I do attend. Well, I've attended pretty much every single one of them. In fact, yesterday I actually attended the West Side Democratic. I think it's Democratic Coalition, and they had a panel on community policing. I think that went very, very well. It gave us as a department an opportunity not only to provide information on the department, but we actually took some really hard questions. We had some hard questions there, especially one of the CPC board members that was, that still had wanted us to make sure that we were still engaging with the community and still working on those reforms that we have been working to ensure that we bridge that gap and get through those barriers, and especially making sure that we gain that trust of still those areas and those communities that still have a little bit of a distrust of the police. So they asked us some hard questions. We answered those questions, and it was good. It was very productive. Again, one of the things that I encourage everybody that I did last night, and I continue to encourage, is please be engaged. Go out to the CPCs. Make sure that you are engaged. And one of the things that we asked is that I asked everybody is we need to start encouraging our youth, whether it's parents, grandparents, to go to those meetings so that they know that they have a voice too. So they have been very productive. I think the CPCs have been good. We're still working with them on some processes.
They meet, Commander, every third Wednesday of the month. Is that correct? At the Taylor
that's correct.
Community Center?
Yeah,
And
right now doing it on Zoom, but it is, yes, at 6 p.m.
6 p.m. Thank you for that, because a lot of people don't know. But if you want more information about that, please contact my office and we can provide those links to you as well. So I guess the other thing that I just wanted to mention was the mayor kicked off a Metro Crime Initiative. And I know you all have been working with the state police. And I think we've seen the reports on TV, but did you want to just comment regarding that?
Yes, so I know that they had been working, they did end some of the operations that they had. My understanding is that they are going to have more. Again, a lot of these initiatives, right now, the number one priority for the community, and understandably so, is violent crimes. That is the number one, and I think it is. I think everybody on here probably has seen that it is something that is affecting every community in the city. And so there are several of those, and even within the department, operations that we are conducting to ensure that we tackle it. And it's not just the enforcement. There is a lot of outreach that is happening currently with the department in the city, where we are reaching out to those individuals that are involved in some of these incidents, and not only them, their family members. I know the department is reaching out to their family members, friends, anybody that they can, to make sure that we encourage them. Look, these are the consequences of us not getting together as a community to try to tackle this issue.
Thank you, Commander. I'm really happy to see that relationship between, inter-police agencies, and that it's working. So I know today is your day off. You probably only have like one day off a year. So thank you for joining us. I think if anybody has any other questions, they can reach out to you at the Northwest Area Command. And if you just want to give your email address really quick, that would be great.
Absolutely. I'll put it in the chat.
Okay.
Again, please reach out to me. Pull up our website. We do have a website in the Northwest Area Command that has all the information on all the officers, that has my contact information, and just reach out to us. We really want to know. We want your input. We don't have all the answers, so we need the community's input. If we're doing something that maybe isn't working, let us know so that we can change and try to adjust to make sure that we have the right resources, that we have the right operations that are going to be working, because our community has a lot of great ideas. We just want to hear about them.
And that is really what true community policing is about, is getting the community involved with the police and breaking down those barriers. So thank you, Commander, for being with us this evening. And I'm going to move over to Pete Gelibert, who is our crime prevention specialist. And I just want to mention also in FY22, our fiscal year budget, the APD received about $222 million, $596 million. So I just wanted to put that on the record, because I was reviewing our budget earlier and just looking at, and at City Council the other night, one of our counselors was asking how many officers we have on the street right now, and the number of 908 total officers was what was reported at that council meeting. So I just wanted to echo that. So Mr. Gelibert, I would thank you for being with us this evening. We always enjoy having you. And for those of you who don't know, Mr. Gelibert is a retired police officer who's come back to help us with so many different aspects of crime prevention. So Mr. Gelibert, go ahead.
Thank you. Good evening, everyone. Thank you, Councilor Borrego. Susan Vigil for inviting the commander and I. Commander had mentioned some property crimes, and I'm looking at the graph in front of me. And since January, the commander is correct. Our property crimes continue to go down. And when I'm talking about property crimes, you're talking about auto burglary, residential burglary, stolen vehicle, and commercial burglary. So that's a good thing within the area command. I just send out the Northwest Area Command newsletter. If any of you have not received it, please get a hold of me. I will put my email so I can send it out. This newsletter has the sergeants and lieutenants for this new bid, has their information and their email and phone numbers. You had talked about Councilor Borrego and Commander Sanchez about our business coalition. We do have one coming up, and that's October 1st from 8 o'clock to 9 a.m. And that's going to be at the Northwest Area Command. This is going to consist of the businesses between the area of Riverside businesses from Coors North, Montano, all the way north to Coors and Paseo. Some of the things we're going to be talking about in the agenda is we want to identify business stakeholders that want to be involved. And that's why it's called community policing. We want to identify their issues, concern on any type of criminal activity. And in return, with the Albuquerque Police Department, we want to talk to them about our resources that we could give them. For example, if they're having auto burglaries, we could have our bait cars at parking lots. We could have our real-time crime center cameras out there. We could have field briefings. So we're going to give them information and educate them. And we can have specialized speakers also. So that's going to be October 1st at the Northwest Area Command from 8 a.m. to 9 a.m. I've been working with the fire department. Fire department has a new program. It's called the ADAPT program. It's the Abandoned and Dilapidated Abandoned Property Team. So what I've been doing the last month, working with the fire marshals, is we inspect businesses from big box stores. I was with them yesterday. We went ahead and inspected a fitness gym, and then we also do apartments. And what we look for is graffiti, if there's an abundance of trash. We also give them suggestions like signage, no trespassing signs. How are their LED lights working? And that's been working tremendously because these type of items, we could actually reduce the calls for service. So we've been working real close with the fire department on that. So we continue on the neighborhood watch. I've got 2 weeks ago on the Del Webb Bearhaven, I did a neighborhood watch startup, brand new. There was 35 people that attended. So I'm continuing to get emails and phone calls of neighborhoods that want to start up neighborhood watch program. It's a good program. Basically, it's your eyes and ears. You have a block captain on your street. You'll have information. The block captain, you'll have your email and phone numbers. And the positive side, if you see anything suspicious, it be vehicle or it be a person, you're going to notify or call the 242 cops. If it's an emergency, 911. Give them a description. And then you're also going to notify that block captain. In return, that block captain is going to notify everyone on that street. So you are eyes and ears, and that helps us a lot, tremendously, so that the officers go out there and respond. We get a lot of suspicious calls for service, and we want those type of calls because that tells us that you're on the lookout. You want to protect your neighborhood, you want to protect your home, your family, and it's a quality of life. So these are the things that are happening throughout the last summer, now in the early stages of fall, and we're going to continue to do that. Again, we've been working very closely, and I want to thank Councilor Borrego. We have an excellent relationship with her, and we give her a lot of information. In return, she gives us a lot of information, and that's what it's all about.
Thank you, Pete. I wanted to just mention the Business Coalition, just to talk a little bit more about that, because I think it's really an important element of what you all are doing. And I know you're doing it for the entire Mesa, right? The entire West Mesa. So you're working with Councilor Pena, Councilor Sena, and myself. So, I mean, I think what's important about it is that the network that you're creating, you know, for businesses helps them when they have burglary or robbery. And, you know, they're able to connect with each other. And I think it seems to me like that's kind of your intent, right? Is to connect those networks.
Excellent point, Counselor. Yes, the businesses we work with is starting from I-40 north to Coors, east and west side, all the way to 528 Corrales, and all the way west, all the way to McMahon and also Unser. But it's a good working relationship. What's nice, I've had businesses call and says, can you give our employees training when it comes to armed robbery awareness? What can they do? What can they not do? Personal safety, shoplifting awareness. And we also do business assessments. So I'll walk around their business and I'll suggest signage, video cameras, anything like that to help these businesses. But it's an excellent working relationship, and we're glad to have this in the Northwest Area Command. But every area command has the business coalitions. They work with businesses.
And I always say that we need to be smarter than the criminals because they've gotten pretty sophisticated, right? So can you tell me if a neighborhood wants to start a crime prevention area, what do they do? What would they need to do?
If any neighbors or neighborhood association want to start a neighborhood watch program, get a hold of me. My phone number, my direct line is area code 505-768-4873. And my email is just the initial P, last name is GELABERT@cabq.gov. They'll contact me and we'll set up a meeting with that neighbor, with that street. We'll elect a block captain and they'll become an official neighborhood watch. And they'll even have our signs, that icon, that blue icon that they could have on the street that lets people know they have a neighborhood watch program that's watching for suspicious activity.
So just getting more eyes on the street to help the police, it sounds like to me, is kind of the goal here.
It is, and it's very effective. What's nice about that, you had mentioned our numbers total with the police department, and every area command for this bid don't have enough officers like they've had previously. So what's nice is we're relying on the neighbors. You're our eyes, you're our ears, so we need your help. And we're working both ends. That definitely helps us. And we could see that in the Northwest Command when it comes to property crimes. Since January, our property crimes continue to go down.
Thank you, Mr. Gilbert. Is there anything else you'd like to mention before we move on?
No, thank you. Again, if you want to start a neighborhood watch, or you know of any businesses that want information, educate when it comes to armed robbery awareness, shoplifting awareness, please have them get a hold of me.
And just lastly, if I was a victim of crime, how would I report that crime?
Anyone who's a victim of crime has several options. One, if you don't have the suspect information or vehicle, you could utilize your telephone reporting unit. So you won't have to have an officer go out there, and you could do it online. Another option, you could actually go to our substation and make a police report. But if need be, if you actually want to talk to a police officer and make that report, give them additional information and some feedback, let the dispatcher know, dial the 242 cops, let them know, my name is Pete Gelibert, I'm a victim, I just got broken into, I have information, I would like to have an officer meet me at my home, here's my address. And the officer will be glad to talk to that victim. And what's important when calling the police is at the end of the year, they total all the calls for service for all the area commands. And by the total calls for service, that's when the chief and all the area commands will look at it and they'll say, okay, compared to last year and the year before, we've had an increase in calls for service, which means we're going to give you additional officers. So the more calls we get, the more officers we get. So it's real important that people do call or call the telephone reporting unit.
Thank you, Mr. Gelibert. We appreciate that you joined us this evening. Again, that's Pete Gelibert, and he is also at the Northwest Area Command. We're very blessed to have him with us. And with that, we're going to move on.
Counselor, I'm going to share Commander Sanchez's number because there is no, there's no
Chat.
chat. Yes, so his number is 505-977-9143. That's 977-9143.
Thank you. And I just mentioned that I'm sorry that I forgot to mention, this is my assistant, Susan V. Hill, who's always there to answer my phone or take my emails when I'm not available. And I also want to mention Julian Moya, who is doing our meeting this evening on Zoom, and we'll put it on to YouTube. He is also a city council staffer, and he does a great job. He does most of our media. So with that, I'm going to move on because time always seems to run short. So we are going to move on to environmental health. And this evening we have with us is our Deputy Director, Mr. Mark Demena. Welcome, Mr. Demena, and thank you for joining us this evening. And we're just going to let you go ahead, and I know you have a lot of things that you'd like to discuss, so let's go ahead and move to you.
Thanks, Councilor Borrego, and thank you and for the welcome, District 5. Good to have a chance to talk with everybody here. I always have lots I'd like to talk about, but for the last year and a half been going on, seems to be the only thing anybody wants me to talk about is the pandemic, talking about COVID. And I think it's very much still a very relevant and very important topic for us. So I'm going to focus most of the public health update on just where we're at with that right now. And just a little bit of commentary. I know folks are very familiar with this, watching it in the news. You know, unfortunately, since the latter half of the summer, we've been in the middle of another surge of new cases. So it's kind of come back in the news after a time where we thought we might be done talking about it for a while. And I think it's really important. The news doesn't always make this really clear, but surges like this, you know, very much like aftershocks from an earthquake, this is something that we absolutely expect to have happen. You know, we were fortunate to be dealing with a very consistent set of strains of COVID for the majority of the pandemic through last year, and going into the onset of being able to administer vaccines far and wide. But as those strains start to mutate away from what the vaccine is preventative against, even with a high rate of vaccination, you know, in the US and certain areas in particular, or in other countries and other parts of the world, we're still going to continue to see surges pop up here and there. Delta is a set of mutations. That variant has a set of mutations that makes it a little bit of a worst case scenario. So as viruses mutate and accumulate different mutations, you may find that they're a little more infectious, or they're a little more deadly, or they're a little more transmissible for people that become infected. And the reason that Delta has kind of taken the world by storm in the way that it has is it's a set of all of the worst case mutations. So it is much more infectious, not necessarily causing more severe disease, but some of what you're seeing now is some very vulnerable people that are tending to end up sick. But the really problematic thing for Delta is that it is able to infect people even that are vaccinated to a degree that they can occasionally transmit virus to other people. So it's helping to sort of sustain that ongoing surge and the pandemic itself. I want to really make clear, though, this is not a situation that we're talking about where the vaccine is no longer effective. And it's, you know, I don't want people to say, well, then what's the point of getting vaccinated? Most of the time, the vaccine is still protecting people from being infected if they're exposed. And most of the time, if they do actually develop a case, they don't, in almost all cases, they're not going to get very serious illness. They're not going to end up in the hospital. They're not going to die. But they're also unlikely to transmit the virus to other people. So the vaccine is still largely doing what it's supposed to do. And if people remember the news when it first came out, we're talking about 95% effectiveness. That translates to 5% not effective. So you're still going to get some cases that will break through. And where you really start to worry about that is when you're talking about lots and lots of cases, lots and lots of transmission. That law of large numbers is going to still translate to quite a few people, even that were vaccinated, even at 5% that are starting to show up with illness. So not entirely unexpected, just unfortunate. I kind of equate it to there being fuel for a fire. You know, there are a lot of people still unvaccinated. And, you know, percentage wise, we're getting lower and lower all the time. Of course, we're making progress in the right direction. But the virus needs to have susceptible hosts, people that it can still infect and that can then pass it on to other people. That's how a virus is sustained in nature. So as long as there are lots of people still out there that are unvaccinated, then when we get these surges of new strains, there's lots of fuel still to burn through. So you're going to see these great big surges, and it's putting a lot of infection pressure, transmission pressure on people that even are vaccinated. So as long as we still have not, reached that very, very high level of vaccination, and I'm talking about, not just here, but worldwide, we're going to continue to see the pandemic rage on. So, if anybody's kind of hoping to be past it, we still got a ways to go. And it's always been a matter of, it's going to be a matter of years before this is really behind us. But for people that are kind of tired of worrying about it, tired of waiting, don't want to wear a mask indoors, the more vaccination that we can get out there, if we can get people to get on board with getting vaccinated, you're going to have a lot less to worry about personally. We're going to dampen transmission, even if it's only in our own country or our own state, and keep ourselves a lot safer. And especially where we're talking about things like kids or elderly people that don't necessarily get a good immune response, that's the best way to protect them, is to have the very infectious people around them vaccinated. In terms of the public health order from the state, which has just been renewed, that's going to continue to look very much like it has since things kind of came back a little bit more restrictive. So the state has said they're not going to revisit the issue of masks indoors until we get to a point in transmission where we're meeting CDC's orange level, which is like roughly 14 cases per 100,000. And we're right now at about just over 24 cases per 100,000. So we've got quite a ways to go before we're going to get to that point. And just, not to beat the dead horse too much, but we're not going to get there without getting higher levels of vaccination and curbing off some of these cases. Having said that, the curve of cases, if you look back on Google can provide it, or the State Department of Health can provide a look at that curve of cases that we saw since the beginning of this in March of 2020. And about the same time last year, the latter half of the summer and going into the fall, we had another surge at that time, which really built up to, if people remember just how dire things got around the turn of the year, the Christmas holiday. The curve of that so far this year has looked almost identical to what it looked like this time last year. So very much the same, just greatly increasing rate of new cases every day. What's great about it, what's interesting about it, and really reflects the importance of vaccination this year, even though Delta is more infectious and more dangerous for us in terms of ongoing transmission than what we were dealing with last year, we are now getting into a plateau at a much, much lower level than we had last year. So we seem to kind of be rounding that corner a little bit. There's some reason for cautious optimism, where it looks like we might get to a point where we're kind of going to drop off of the Delta surge and start to go back down again. But really look at that curve, because it's fascinating. You see how high daily transmission rates got last year, going in late November into December and the end of the year, compared to where we're plateauing this year. You can really see what vaccines are doing for us as a society. That's largely to be expected, where Delta has already moved through in other parts of the world. First originated in India, moved through the UK as well, but it had about a 2-month cycle where it really burned through, caused a lot of cases, a lot of death, and then gradually kind of tapered off. And I equate that back to the concept of, kind of burning through fuel. So as more and more susceptible people are tied up with infection or have recovered, or in many cases get vaccinated, but if they have any kind of short-term immunity, it sort of depletes the fuel for a while. One of the things that we're hoping is that that's going to sort of outcompete some of these other strains that are starting to make an emergence already. If people have seen in the news talking about Lambda and Mu, I hear about COVID every day, and I can't tell you how many times I've already heard the joke about it's all Greek to me, as they're giving Greek names to all of these variants. So anybody wants to crack the joke, I've heard it already. Lambda and Mu both look to be problematic variants, but they don't seem to be able to really pick up the speed that Delta did, because Delta is still so active in so many parts of the world. So hopefully we can kind of avert those for a little while. But as long as there are still susceptible people out there, as long as we haven't really beat back the pandemic, new strains will continue to emerge, especially in areas of high transmission where vaccination is low. And I'm not talking just about our state or this country. I'm talking about other parts of the world where vaccination really hasn't even started yet. And so there's lots and lots of opportunity when you're talking about a global pandemic for there to be really heavy transmission pressure, evolution, and new mutations that start spreading around the world. So we probably, unfortunately, aren't at a point where we're close to hearing the last of COVID, but hopefully every time it comes back around, that plateau of cases, like I'm talking about, gets lower and lower. And eventually what we're imagining is this is going to end up being like flu, where there's always going to be a little bit of flu out there. There's always going to be a little bit of COVID out there. Some years will be worse than others, but we've got a regular vaccine for those that are at risk. And, you know, I know it's been talked about since the beginning of this. There are people that are very vulnerable to flu. We have a lot of deaths every year from flu. If you're still suffering from the delusion that flu and COVID are even in the same ballpark, look at the data. It's just very, very far beyond that case. But we can expect a time where COVID might kind of fade into the background and be, you know, there's a bad COVID this year. Get the vaccine if you're susceptible. But if you've had the vaccine before, you probably have some protective immunity and you won't have to worry about it. That's really the long-term picture where we're hoping to get to. I get asked a lot about school cases, and you know, we're very much following what the Department of Health has to say about that. But it does seem like statewide we haven't had a really huge number of school cases. Those really scary large-scale outbreaks that we were worried about going back into the school year haven't manifested, and that's probably got a lot to do with the pressure that's been on to get school staff and teachers and faculty all vaccinated. So you've actually created a layer of insulation around the students that can't get vaccinated. The older students, the 12 to 17-year-olds that got an approved vaccine a little bit later, have been starting to pick up their rates as well. So they're getting good protection at the sort of high school level. But for younger kids, we're able to protect them so far. If you've been following the news as closely on this as we have in environmental health over the last week or so, it looks like Pfizer will probably have an approved vaccine for kids 5 to 12, 5 to 11, 12, maybe as soon as Halloween. So when that becomes available, I may not be addressing you again before then, but by all means, please get your kids vaccinated. It's probably even safer in kids than it is in adults. And these vaccines are very, very safe as vaccines go. I know there's been a lot of doubt about that, but at this point, there's been hundreds of millions of people vaccinated. No vaccine ever gets that significant of a phase 3 trial, and we really don't have any significant health consequences that come out of those, other than people feeling crummy for a day or two. So they've been proven very, very effectively to be safe. The Pfizer vaccine's fully approved through Pfizer, through FDA now, and that's as gold standard as it gets for a vaccine. So I think that's, you know, recapping kind of, you know, where we're at with COVID in a nutshell. Hopefully over the coming weeks, we'll start to see a decline again. Possibly we might see an additional surge later in the winter, but, you know, we'll just have to do what we have to do to try to prevent that. It's kind of getting to be customary at this point. I will say going into September and October, and especially because our hospitals continue to be the area we're most concerned about in terms of their capacity to take in patients, please, 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 last year was very important. This year it's going to be very important again. Get the flu shot. You don't want to end up getting very sick with flu this year and looking for a hospital bed and they're all tied up with COVID patients. So by all means, get the flu shot. There are no restrictions about getting a flu shot right alongside with the COVID shot. In fact, eventually you'll be able to get them both in the same needle, or possibly even they're starting to develop intranasal, like a mist now for COVID vaccination. So at some point that'll be available as well. But definitely get the flu shot. It was really effective last year to have so many people prioritize getting a flu shot. We had almost a negligible flu year, and that's really the impressive outcome of people wearing masks, staying away from each other, getting the shot. And then the last thing that I'll just add quickly on a completely completely different subject. I've been approached a lot. You can see my mosquitoes in the background here. Mosquitoes are my first love, even before I got to talk about the pandemic all the time. We've got a lot of mosquito complaints coming in this year. The weather conditions aren't really contributing to that. What's really going on, we have a new species of mosquito that's established itself now in the Albuquerque area. It's called Aedes aegypti. It's commonly known as the yellow fever mosquito. Yellow fever is not really an issue for us in this part of the world, but Aedes aegypti can carry lots of other things. Dengue, chikungunya, Zika is one people are familiar with. I'm not really particularly concerned about transmission of any of those, but Aedes aegypti is a mosquito that's very, very adapted to living in close proximity to people. So if you've lived here for a long time, you're probably used to mosquitoes being an issue when you get down into the bosque, maybe some of the golf courses or parks where there's more moisture, more humidity, but not necessarily in some other parts of town. That's not likely to stay the case with Aedes aegypti establishing itself here. It can breed in very small amounts of water. It likes to be very close to people's houses. It's not as sensitive to staying in wooded areas. So we're seeing it popping up all over the city in areas that we haven't really had it before. And it's very, very difficult for us to control. We're used to doing spraying and, so same areas I've been listing, parks, bosque, that type of thing. But when you get into talking about, residential neighborhoods, and these are breeding and things like flower pots and bird baths and little containers that maybe the kids left in the yard, wash tubs, that kind of thing. And it takes very, very little water. You can actually find mosquito larvae in like an upside down cap from like a jam jar or like even a Coke bottle. It takes very little water to support them long enough when it's warm for them to reach adulthood. So we really want people to start looking for that standing water around their homes and do whatever they can to turn that upside down, drain it, not let it collect water in the future. We'll be pushing that message really hard as this continues to get established. It got very bad very quickly this year with Aedes aegypti. So by all means, call us and we can provide some help with what to look for and how to take care of that. But I'm hearing that from all over the city, and I expect it to be an ongoing issue.
Thank you. Thank you, Mr. Demena. So the issue with mosquitoes then, when the temperature starts changing, I mean, is there a temperature where mosquitoes sort of go away or go into hibernation or something?
Yeah, there is. So when we get the first hard frost, a lot of the larvae that are left out there, a lot of the adults that are left out to exposed to the elements will die then. They get a lot less active even as the days get shorter. So even before it gets really that cold, we'll start to see a pretty significant drop off. And I usually tell people mid-October, just after Balloon Fiesta, we tend to have the days getting short enough. The mosquitoes, it's called diapause, but they basically become fairly inactive going into the winter. A lot of them will find things like cellars or garages or place like that they can overwinter and come back in the spring ready to lay eggs again. But yeah, I would think we've probably only got another maybe 3 or 4 weeks. It gets a little warmer later into fall every year, it feels like, so could be even approaching Halloween, but I wouldn't expect we'll see a lot of that activity much beyond that.
So it may be a good idea because the Balloon Fiesta is coming up, and there's a lot of green and a lot of wet, moist. Maybe even just take your mosquito repellent with you to the Balloon Fiesta, it sounds like.
Yeah, never a bad idea.
Yeah. And another issue, when you were talking about, I think you said Lambda and Delta Lambda, and I didn't catch the third one, but what I guess, is there a booster? What is the status of the booster shot now? Or is there?
The subject of the booster has become very confusing in the last couple of weeks. So unfortunately, the Biden administration came out pushing really hard for the third booster, and they were talking about it being for everybody. And great that was what they intended to do, but that is not what the FDA ended up approving. And they've, in fact, the CDC had their committee vote on that just today. So things are moving very much in the direction for people who are seniors or have a compromised immune system, who may be very vulnerable to COVID and may not be able to mount a great immune response even when they're vaccinated. They're the ones that they're really particularly trying to boost their immune system even harder, so they'll get that booster. That's what's been approved for the third shot. The average person, a lot of us were expecting, we were being told that the third shot would start becoming available later in September, around now, between now and mid-October. And that is, unless something changes drastically here at the last minute, that is not likely now to be the case. Just to clarify though, that booster was exactly the same vaccine that people were already receiving. They hadn't changed up the formula or the sequences that are in there at all. So I think at this point, where people might next start to hear about a booster is when the vaccine manufacturers will revise what's included in the vaccine to make sure that it's a little bit tweaked for whatever strains may come out later. The current vaccines are still very protective against Delta. The reason that you're seeing breakthrough cases that are starting to be reported on the news is because there's just so much transmission. The best way that I've heard this equated is you can carry an umbrella or have a great raincoat. When it's just sprinkling, you're not going to get wet. When it starts to rain a little bit harder, you're going to get a little bit wet. That's that 5% of people getting cases anyway. When it's a monsoon, like we get here, if you've been caught out in a monsoon trying to get to your car, it doesn't matter what you got, you're going to get wet. And that's really what that high level of transmission pressure is. There's just so much going on that those breakthrough cases are really just going to happen, and you're going to get enough numbers to start to see them. But the vaccines that are out there are still actually quite protective against Delta. It's just that they're still only in that 95% range. Some of the other strains, Mu in particular, which I think is the one that you may not have caught, that one has shown some characteristics that make it look like it could be even an escape strain, as we refer to it, which means that it
And
may,
what was that name again?
it's Mu, MU.
MU. Okay, great.
Yeah, and that one may be able to bypass defenses from vaccines. So you could imagine a time later where they will update the vaccines to provide better protection against that strain that's emerging as well.
Thank you. And just on a final note, this is diverting from this discussion. I know that your department is working with the commander on the business that we mentioned earlier, and we didn't really say the name, but we want to keep our businesses in business. So can you just give us just a really quick recap of what it is your department is doing, what role you're playing in that particular issue?
Thank you. And I'll try not to inadvertently name anybody by name either. We have received a lot of complaints of the same nature. So far, the majority of those complaints, as was mentioned earlier, have come from Corrales. And unfortunately, the way that, so environmental health enforces the city's noise ordinance. The city's noise ordinance, we have to enforce it where we have jurisdiction, which is within the city. And in particular, it's written in such a way that it talks about a source premises, which would be this business in this case, and a receptor premises. And there are allowable sound levels from one source to one receptor. We don't actually have an assignable sound level at the receptor premises when they're outside of our jurisdiction, because we don't have any purview there. It gets a little more complicated when you start to look in the other direction from that business, and you get into the surrounding areas in that direction are not residential. They're largely various versions of commercial, or even like there may be some light industrial type of zoning there, where the allowable levels are a lot higher. And sound, it's carried through the air in waves, so it has some interesting properties the way that it can travel. So we have to look where we can get readings, and they may not always be where the sound can be most clearly heard. When you go off into the other direction, you have to go a ways before you start to getting into some residential properties. We haven't had a lot of complaints so far from residential properties that are within city limits. But my understanding is that we started to have a couple of those. We've been talking with some of the complainants so far about whether or not they'd be willing to let us come out and take some readings there. But we did like basically a surveillance run, took readings all throughout the area, both in commercial and residential areas earlier in the summer on a night where we could audibly hear sound, but the readings were all in compliance. So, and it's the noise ordinance doesn't know, and our sound meters and generally noise enforcement don't know how to differentiate between things like traffic noise or a low flying plane or kids yelling or whatever other kind of sound there is. So the sound levels have to be geared towards something that is distinctly more audible than just something you can kind of hear in terms of ambient sound. So,
so I
sitting on
guess
my porch.
I'm sorry.
Sorry, go ahead.
No, go ahead and finish your thought. I was just gonna say, this is still in process, right? I mean, you guys are
Very much so.
Yeah, so
Yeah, very much
it's
so.
a sampling of different times and different days and
Yeah.
okay.
Yeah, and I mean, part of that too, the sound, the source of the sound could be different on different nights, and we've certainly had that reported to us. Some nights are louder than others, so I would definitely welcome the involvement of APD. I'm glad to hear Commander Sanchez is going to be assisting with that, because they can dispatch people more quickly than we can. We sort of have to plan these things a little bit more in advance, just because we don't have the dispatch and we don't have the staff resources. But we'll continue with it. We've worked a lot of similar noise cases over the years, and they do take sometimes a long time to resolve or bring to somewhere where everybody can kind of get by satisfied. But we understand the concerns of the residential neighborhoods in all directions, And we also understand the need to allow the business to do what they do. So I think we want to try to find a happy medium there, but it's very much an ongoing issue.
Thank you for being with us this evening, Director Demena. Is that right?
Demena.
Is this
Yep.
yeah.
Not a
Um,
common name in this part of the world. So
We appreciate Italian, right? Is that?
that's
Italian?
right. That's right.
Yeah.
Yeah.
Thank you for being with us, and we look forward to the findings for that particular issue, because it's been a big issue. I know on Nextdoor, which is not my venue, because, you know, obviously I have city resources that are otherwise. So we will be watching that, and I look forward to hearing the final reports regarding that issue. And thank you for your discussion this evening. We are going to have to move on. We did have AFR with us this evening, and they were having technical difficulties. We had Battalion Chief Pasquale Galucci with us, and because of their technical difficulties, he's working with one of his interim deputy chiefs of emergency services, and they sent us a report. So I am going to just read their report into the record, just because they had to sign off. Apparently their Zoom is not working either. So we've had a few technical issues to get through this evening, but we are going to try to put this on YouTube for you so that you can listen to all of these individuals who are experts in their field. With regard to the report that I received from Interim Deputy Chief Christopher Ortiz, the questions that were given to them was how many firefighters have had COVID-19 since the start of the pandemic? And the answer to that is 184. So that's quite a few. That's quite a large number of our firefighters and paramedics that have been affected by COVID. How many currently have it? The number is better. It's 3. So that's good to know that, you know, that number has dramatically reduced, but yet it's still not, you know, gone. How many have been hospitalized? They have 2 that have reported that they were hospitalized. How many currently are in the hospital? We don't have any. That's a very good number when it comes to this particular issue. And then how many PEM hours have firefighters used since the start of the pandemic? And I'm not exactly sure what PEM stands for, and Susan or anyone else that can jump into that, if you could tell me what that is.
I
200.
believe it's paramedics, emergency something unit.
Okay. So how many PEM hours have firefighters used since the start of the pandemic? In 2020, it looks like it was 18,372.25. In 2021, January to July 31st, it was 7,932.37. So that was the report that was sent over to us from AFR. If you have questions regarding that, you can contact my office and we can try to get you some answers regarding that. So our next order of business on the agenda is we are going to move to our next group of speakers. We have with us this evening Mr. Rick Hidon, who is the Community Services Project Manager from Family and Community Services. Thank you, Mr. Hidon. And also I see our Deputy Director, Lisa Hubal. So I'm not sure who's going to address this, but I will go to you, both of you. Thank you for being with us. And of course,
I'm sorry, Deputy Director Demena corrected me. PM is medical leave. So that's the medical leave that they've logged.
oh,
related
that's
to
the
COVID.
number of hours of medical leave for COVID. Okay, thank you so much. Appreciate that, Susan. Okay, so with that, we will jump over to Mr. Hidon and Ms. Huval, I'm sorry.
Thank you, Counselor. Thank you for the invite. We wanted just to give you an overview of our affordable housing initiatives that we've been planning for at the Cibola Loop site, and just kind of like a historical timeline of things that have occurred. And so the community is aware, I know there's been a number of questions related to it. And we'll just start from the beginning. Back in 2018, the city's Department of Family Community Services allocated $1.439 million to acquire the 5-acre parcel on the Cibola Loop site. And that money came from the Department of Housing and Urban Development, so HUD funds, and it's their community development block grant funds. And the idea was to promote the construction of affordable housing units. That means that the requirement was that 51% of the units that were going to be constructed had to be affordable to households.
Mr. Hudon, before you go on into the specifics of this, I just want to
Sure.
give a little bit of background for those of the individuals who don't know about this project. We have about 20 acres at Cibola Loop and Ellison. And there was a master plan done probably about 4 or 5 years ago. And it outlined, it was a group of community meetings, first of all, and there was input from the community, and it outlined basic uses for this property to be developed: a multi-gen center, a library, a swimming pool, and affordable housing. So with that, I'm sorry to interrupt, but I
that's
wanted
perfect.
to give the context of that.
Thank you for that. Since the HUD funds were used, it required that 51% of the units would have to be affordable to households at or below 80% of the area median income. And so with that, our department released an RFP in 2019, a request for proposals, looking for affordable homeownership projects. The first RFP was unsuccessful. There was challenges related to the costs associated with building single-family homes under certain thresholds required by the funding source. And then in 2020, we decided to put out another RFP for homeownership, and trying to see if there was still that challenge. And we didn't get any respondents to that second RFP. So it was clear that it was very difficult for the developers that we typically work with to build single-family homes under a certain cost. The cost of construction, as you may be aware, had been rising significantly over those last couple of years, and there was just no way to actually do it. With that, our department looked to other opportunities. What else could we do with this land related to affordable housing? And so we held a public meeting on December 9th of 2020 to kind of outline the ideas that our department had, given the challenges it faced with the previous RFPs. With that, the idea was to promote affordable housing for seniors in a rental development. And so that was the outcome of that December 9th, 2020 meeting. We developed a new RFP, request for proposals, which was released in May of 2021. And that allocated the 5-acre parcel of land and $3.2 million of HUD home funds towards the construction of a new multifamily senior rental housing development. And so that, again, was released in May of 2021, and the request for proposals closed in August of 2021. So as part of this RFP, the developers of the proposed projects had the opportunity to obtain points related to public outreach. And that's probably why a lot of the District 5 residents may have been invited to meetings of specific potential projects that developers were about to propose to our department in response to the request for proposals. That being said, there were four, as the RFP closed, there were 4 proposals received in response to it, all of which are currently still being reviewed by the ad hoc selection committee. The ad hoc committee will make a recommendation of award to the department director. And once the recommendation of an actual project is approved by the department director, a contract or development agreement will be drafted and routed to city council for approval. And based on the current timeline, we expect that a development agreement could be in front of City Council as early as November of this year. So I don't know if there's any other specific questions or details, or if Lisa Uval, if you would like to add anything into that description that I just gave.
No, I don't have anything to add. That was a really good summary.
So I think that just a recap, how many RFPs total went out? And 3 were denied, correct?
So
And
there
then-
were
uh,
two
is this
two
the third?
RFPs.
2 RFPs, and this is
Two
the
RFPs
third
that
one.
were initially, one was in 2019 and one in 2020. Both of those were for homeownership, and they were unsuccessful, and we didn't receive respondents for the second one, as both that and the first did not have projects proposed that were under the threshold requirements. And so then
Yeah.
in 2021, we released the RFP for a senior rental development project.
One of the questions that came up to me was with regard to community involvement. And throughout this process, there has been either through Zoom or live in-person meetings, correct?
Yes. In fact, when the city initially acquired the site, requirements of the federal funds associated with it, we have to publish in the newspaper and provide opportunities for public input. And so that occurred back in 2018 when we put out the RFPs in 2019, 2020, and 2021. These are all published documents that are in both in the newspaper and on the city's website. So it's open for anyone to comment on or to ask questions about. It is all public.
So really, this is the beginning. Once the RFP, whoever that developer is, I guess, once that's been accepted and City Council approves a development agreement, then there's still the whole issue of a site plan being approved by the planning department and specifics regarding access and traffic impact and all of those sorts of issues, correct?
Yes, you are correct. In fact, once there's an actual project that gets approved by council, it will be some time before construction actually occurs. It will have to go through the typical city processes, whether it's the design review board or the EPC or any of the other city processes through the planning department. There will be the notifications to residents of those processes as well.
So there's still a huge opportunity for public involvement at any of those points.
Definitely.
Okay, thank you so much. Thank you for your work, Mr. Idon. And Ms. Huval, would you like to say anything? Director?
No, you did a really good job. So I don't have anything to add, except I guess maybe that our department's really excited about this project. We know there's lots of seniors in our community who need a safe and affordable place to call home, and we're excited to help make that happen.
Thank you so much for joining us this evening. We know
Thank
that
you.
your schedule is really busy, so both of you. We are going to move on to another portion of the Cibola Loop development. And this is the Multi-Generational Center, which is a center kind of similar to the one up on Wyoming in La Cueva area. At least that's what we're looking at as a model. And with us this evening, we have Senior Affairs Deputy Director Chris Sanchez. Mr. Sanchez, thank you for joining us.
Oh, thank you for having us, Councilor Borrego. We're excited about the project as well, too. I mean, just a few minutes ago, they talked about the 20 acres on the Cibola Loop complex, which is great. We're looking about 9 acres for our multi-generational center. We are in the final design of our documents, which should be completed by October, we're hoping. And the big part is obviously the financial funding for the project in itself, which looks like it's going to come in somewhere for the first phase around $14 million. What that's going to look like is partnerships between the city, the state, and our federal government to really try to figure out how we can accrue all those dollars needed to complete the project as a whole. But we're extremely excited. We're looking at about 29,000 square feet, and you alluded a few minutes ago to our other 2 multi-generation centers. Our first phase is going to look like a social hall and classrooms and fitness center, actually state-of-the-art fitness center, which is really cool, aerobics rooms and kitchens and our climbing gym. What we're looking really as we're reviewing the designs as we speak is what is going to be the most efficient and more best practice approaches for providing programs and services for our seniors and our youth within that specific area. You know, we're looking at our morning and after school programming. We're looking at our summer programming for our youth. We're looking at all of our senior programming, which we know that there's not a center in that vicinity. And so we're really excited about what the first phase looks like moving forward.
Who is designing the multi-gen center? What
So we're
firm?
working with FBT Architects, along with our parks and our culture and family services design teams together.
Great, thank you for that. So tell us a little bit more about what, you know, sort of the vision for how you see that center sort of integrated into the community, and, you know, how other centers operate in the city, because we're one of the few districts that doesn't have a center. So, you know, we're all looking forward to this, to be able to go and walk and talk, you know, socialize, and hopefully get out of COVID, and we can do that. And it's for youth and all ages above youth. I mean, our seniors, and yeah. So just tell us a little bit about.
Absolutely. You know, the thing that we're most content about is how we actually interact with the community as a whole. We often will be in the community doing outreach. We have a great social services program that provides case management services, looking for opportunities to provide, you know, meals for folks that may not potentially have meals. We're looking at actually engaging our population and to finding out what are those things that they like most about coming together, right? So whether if it's arts and crafts, if it's dancing, which I got to tell you, our seniors love that, especially now that our senior centers are open. Really engaging in our youth and really trying to figure out where are those needs that we can help fulfill. As you know, that we always are ranked worst in education for our children, and so really figuring out how can we play a part in helping our children and our youth in the educational system. So we're looking at how do we engage our folks, use data to help us really analyze what are the best programs and services that we can actually provide, and then being there, right? And you're absolutely right. I've looked at that northwest quadrant, and you're trying to say, well, okay, so what is there? What kind of activities do we have? How do we want to help our aging population age appropriately throughout, and really designing the center to meet those needs, honestly. And it's really on the constant communication between ourselves and our community out there of really designing something that is going to be used and really is theirs. And so we're excited. I got to tell you, we're really excited to hopefully, look at breaking ground next year. We're very excited for your support, Councilor Borrego. You've done a great job at helping us move this project forward. I can't wait till we're actually there to break ground, and then really be able to cut that ribbon and open up so our seniors and our youth can be able to use those facilities. And we're really excited about the multi-gen process, simply because that's the age of our future, right? If we can really bring our seniors and our youth together collectively, it's just going to provide for a great community out in that northwest quadrant of Albuquerque.
And I think we're working with our delegation, also asking them for some funding. Senator Ben Ray Lujan and Senator Heinrich. And I just have to give kudos to some of our legislators, Senator Pope, who's helped us get funding, some of our representatives, Karen Bash, Joy Garrett. I mean, the list goes on and on. Katie Duhigg. I'm just really happy that everybody's working to to make this happen, because it really is going to be sort of a regional use as well, right? Since we're on the
Absolutely.
border of Rio Rancho. Yeah,
Absolutely.
maybe they can give us some funding as well.
Well, it's amazing what can happen when different municipalities and folks come together. What could be accomplished for our folks in our community. It's so exciting.
Thank you so much. We appreciate that you're here with us and joining us this evening. We are going to have to move on a little bit here, but if you'll send our regards to Director Pierce. I know she was out of town tonight, and I will make sure that she knows you did an excellent job in representing her. So thank you for being here with us this evening. And with that, we are going to move on to some of our closing remarks. I want to thank all of our guests for being with us this evening. They all.
Can I just add, Mr. Demena, Deputy Director Demena of Environmental Health, sent his number for people to contact him.
Oh, yes, go ahead.
That is 768-2712. 768-2712. That's for questions on the mosquito. It was an Egyptian variety, and COVID or any kind of noise ordinance issues. Thank you.
And Mr. Sanchez, before you go, do you have a number that you want to provide?
I do. I'm sorry. Yes, it's actually 764-6400. If there are any questions or comments or suggestions, please feel free to call me at any time.
Oh, I'm sorry. The director that you work with is Director Ana Sanchez.
Ana Sanchez, correct.
Yes, thank you. I was thinking of Mr. Hedon. Do we have a number for Mr. Hedon?
One moment. Get it. So, am I mute? It is 768-2968. That's 768-2968. He's a community services project manager with family and community housing.
Right, and he's the gentleman that works with Director Pierce. So I'm going to go back to kind of the beginning. I wanted to talk a little bit about some of the things that our office is doing before we wrap up this evening. We just published, thanks to Susan, our quarterly newsletter, and it should have gone to all of our neighborhood associations in the area to tell you a little bit about some of the projects that we're working on in the district. I'm happy to tell you that West Side Boulevard, which is a $10 million project, is currently underway and is in construction. And that is the area that connects Albuquerque to 528 in Rio Rancho. So that is currently under construction. I also wanted to mention to you that Paseo del Norte is being designed. It is a $57 million project. The portion that is the city's is a 27 million. And I'm happy to tell you that we have $20 million. That project is in design, and that's to add 4 additional lanes, 2 going east, 2 going west. So that would be a total of 4 lanes actually. And we're excited, we're looking for the additional $7 million. We will be going to the state legislature asking for capital outlay again. Also, I would mention that Unser Boulevard, and I just got the number today, we have $16 million, and that is up on the escarpment to also add 2 additional lanes, so a total of 4 lanes traveling north and south. That project is also in design, both projects in design. That is also a $57 million project. The city's portion, $27 million. And as you can see, we're about halfway there. We need about, and that project, Unser, we're looking for funding from the feds on that. And we are working with our delegation regarding that. And that's part of the infrastructure bill we've asked for some funding in that bill currently. So if you talk to your legislators, this is the time to really, tell them that we need their help to obtain the funding that we need to go into construction on these projects. I will tell you, both of these projects require property acquisition. And that property acquisition, we've already started to identify those properties. In addition, on our November ballot, we have about $3 million that we're requesting for McMahon Boulevard. McMahon Boulevard is currently in design. We were able to obtain enough money to do the design to fix that area on the west, kind of west of Unser Boulevard. We are asking the voters to support the November initiative, which is on the ballot, to add $3 million to that project. So take a look at that when you go to vote, because that's an important project. We have about 7 traffic impact studies that are currently underway, including the entire length of Golf Course Boulevard, the area of Irving between Paradise and I think that street is, I can't think of the name of that street, Susan. It's Kimmick, right? Is that right?
I thought it went to the little street that's called Paseo del Norte, but it's
Paseo
a
de-
highway.
No, it goes further than that. It's almost to Universe, but not quite. And I'm not, I can't think of the name of the street right off the bat. But anyway, that's another traffic impact study that we're working on. Rancho Sereno, we're just kicking that off in the next week or so. There's quite a few people that are cutting through that neighborhood and speeding. And that, I think the neighborhood is going to be happy that we're going to be looking at those cut through streets and trying to slow that traffic down. Universe and Irving, an area that we've had problems. That whole area we're looking at between all the way from Paradise all the way to Irving, and see what recommendations come up there. Rainbow, Las Terrazas, and then some smaller studies that we're looking at are Kimmick, Castanoga, Tasuki, I hope I pronounced that properly. And then also looking to restripe Black Arroyo Road, which is right on the edge of Albuquerque and Rio Rancho. So those are some of the things that we're looking at with regard to infrastructure. We have a number of park improvements that we're looking at. And I sort of am running out of time, but I think it's important to let you know that if you're interested in finding out more about that, call us 768-3100. Susan and I are available. We will talk to you. We're happy to talk to you. My email address, cynthiaborrego@cabq.gov and Susan B. Hill @cabq.gov. And we're always happy to try to return your call as promptly as possible. I also wanted to mention, Susan, did you have something?
Oh, I looked up the Irving boundaries. It's La Paz to Rio Los
La
Pinos.
Paz. I
It goes
couldn't remember.
past
Yeah,
a
La
little bit
Paz.
past Unser, or
The peace, right? Hopefully we can provide some peace to that neighborhood. I would also like to mention that prior to this meeting, we did do a request for any questions, and we did receive one question from a gentleman by the name of Jim Hoffman. And his questions are the following. He wanted to know about changing the CIP ranking criteria for the city from the 1980 boundary to the 2000 city boundaries. And we did send that question to our CIP staff. We do have a formal response, which we're happy to share with anyone that is interested. But basically what he said is that it would not really change the way that they analyze the data for improvements to our capital improvements program. So I'm just trying to answer this as quickly because I've only got a couple of minutes left. He also asked about Unser Boulevard expansion. He wanted to know what the update was on securing funding for that, and I've already mentioned that. And also he was curious about a utility corridor expansion for Volcano Heights area. I will tell you that I do know that the flood control, AMAFCA is working on that. There are some questions with regard to ponding, and they are looking at purchasing some additional property to provide a new pond area. That's a new needed pond area in that vicinity. So, you know, funding is always an issue with these projects, and we always try to work together as the city and all of these agencies try to work together to pull our funding together, actually. With that, I think that is kind of the end of our time. We want to thank you if you joined us tonight. And as always, we are, as I mentioned, we're always trying to be available to you to answer your questions and to provide the support that our community needs as we move forward into the future. So thank you to APD, thank you to AFR, thank you to Environmental Health and Family and Community Services and Senior Affairs for joining us this evening. I want to thank my staff, because without them, we could not do this. So thank you to Susan Vihill and to Julian Moya also for working with us this evening. So have a great night, and we'll see you soon. Good night.